So many of my patients ask for sleeping pills, but they refuse sleep studies. And when they feel that they can only sleep when they're taking medications, the idea of trying something different or tapering off that medication is really scary. There is an FDA black box warning about serious injury or death from these medications resulting from complex sleep behaviors. My patients have better sleep and better energy and even less anxiety once they come off these sleep aids. All of this is not to say that sleeping pills are bad or you should never use them. The key is that sleeping pills are a tool. They are a tool to be used when appropriate. Today, we're talking about how to support your patients who are struggling with sleep, but don't know how to sleep without relying on sleeping pills like Ambien or Zolpidem. I'm in a lot of physician Facebook groups, and this question comes up all the time. So I'm going to share with you my 5 steps to supporting these patients. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. This channel is all about practical clinical tools that you can use in your practice to better support your patients with sleep. Go ahead and subscribe to this channel and click the like button. Doing so is going to get this information out to more clinicians like you. Every video is also eligible for CME credit, so watch all the way to the end and then grab your CME credit. The link is in the video description. So I'm going to share this one question that I saw recently in a physician Facebook group, and this was posted by a family medicine doctor. And they wrote, "So many of my patients ask for sleeping pills, but they refuse sleep studies. I'm trying to get them off Ambien or Zolpidem, but nothing works, and every time we try something new, they call the office with side effects, and they say they have the best sleep hygiene. What do you suggest?" So I'd love to hear from you in the comments. How would you approach this type of a situation? Let me share with you my 5 steps of how I would talk to a patient who is struggling with this. The first thing that I would do is to start by empathizing with them. Validate the patient's concerns, because when somebody is struggling with sleep, it's really frustrating. And when they feel that they can only sleep when they're taking medications, the idea of trying something different or tapering off that medication is really scary. So I would partner with the patient in this conversation and just share with them that you understand their concerns, that it's scary. Validate those feelings. Doing so is going to first help the patient feel a little bit more comfortable having an open and real dialogue with you about this, so they don't feel like you're just trying to take away their meds without good reason. And it's also going to help them feel like you're in partnership to actually get to the root cause. Keep in mind, this can be a series of conversations. This can take a long time to get patient buy-in. It may not happen straight away, but showing that empathy and validation is going to help you get further with the patient. And it's also going to help improve the rapport with you and your patient. I would also like to explore with them, what are their goals for their sleep? What might it be like to be able to sleep without sleeping pills? Imagine the freedom that comes with that. So just get them thinking about that. And then also emphasize that it's your responsibility as their physician, as their healthcare practitioner, to provide them with the most appropriate information, the most appropriate treatment, and the safest treatment options for their needs. And so part of that is having this conversation about the appropriate use of sleeping pills. The second thing I would do is actually explain to the patient why you're concerned about this specific treatment, about the specific drug, Ambien or Zolpidem, or the class of drugs, the Z drugs or the Z drugs. You can actually see my video on is it safe to take sleeping pills, and you can even share that video with your patients if you wish. So I would emphasize that Ambien or Zolpidem, these drugs were never intended to be used long-term, and they don't treat the actual underlying cause of the sleep issues. There is an FDA black box warning about serious injury or death from these medications resulting from complex sleep behaviors. These medications can also cause tolerance, dependence, and rebound insomnia, so they can actually start to cause the very issues that you were trying to treat in the first place. These medications were never intended to be used long-term. They're not recommended to use for more than 2 weeks at a time, or only intermittently. They're not intended to be used daily on a long-term basis. These types of medications can also cause daytime fatigue and cognitive impairment. So patients might notice they just feel kind of tired, or they have brain fog, or it's just kind of harder to function. And it can be kind of insidious. Many patients don't realize they're even experiencing that until they actually get off the medication, and then they see the difference. And then these medications can also cause respiratory depression, which is especially dangerous if they have untreated and undiagnosed sleep apnea. If this type of information is helpful, then go ahead and grab my free sleep mini course for outpatient doctors. It's jam-packed with high-yield tools that you can use in your clinical practice. You can get that at intrabalance.com/doctors. The link is also in the video description below. The third thing that I would do is emphasize that chronic insomnia is highly treatable. People can have great success in overcoming insomnia without medications. In fact, in my clinical experience, I find that my patients have better sleep and better energy and even less anxiety once they come off these sleep aids. You can also discuss other root causes that are possible in your patients, so things like obstructive sleep apnea, restless leg syndrome or periodic limb movement disorder, circadian rhythm disorders, mood disorders like anxiety, and so forth. All of these things could be potential contributors to insomnia. Chronic insomnia is also a type of learned hypervigilance where the nervous system is on high alert, and that can be a learned behavior. With effective treatment protocols like CBTI or cognitive behavioral therapy for insomnia, which is the first-line gold standard treatment for insomnia, and it works in about 80% of people. The fourth thing I would do is reassure the patient that you're not going to take away their medication abruptly, that you don't want this to be a painful process for them. You can talk to them about the appropriate way to safely taper off these medications because they should not be stopped abruptly because of the risks of withdrawals, which can be quite dangerous. So talk to your patients about doing a slow taper. And when I say slow taper, I mean this could take 6 months, it could take a year, it could even take 18 months to slowly taper off. I also emphasize to patients that, look, it's going to be a little bit uncomfortable. It can be physically or mentally uncomfortable as you start to taper, but we'll work on ways to navigate and manage that discomfort while you also build skills to learn how to sleep better and we address the underlying causes. It is a bit of a process, but at the end of it, you'll feel so much better. The fifth thing I would do is to actually start to create a plan, create a taper schedule, and then a plan to evaluate the underlying causes and then implement sleep skills from CBTI to build their sleep confidence. Make sure you stick to the plan and avoid falling into that trap of jumping from one sleep aid to another, because oftentimes this can actually make the problem worse and reinforce the idea that the patient can't sleep without medications. All of this is not to say that sleeping pills are bad or you should never use them. The key is that sleeping pills are a tool. They are a tool to be used when appropriate. It's when they're used inappropriately that they can start to cause issues. So be patient with your patient and set expectations about the taper schedule, stick to it, and then also set a date for a sleep medicine consultation if that's appropriate, if you need to look at underlying causes or get a sleep study. Also set a date for a consultation with a CBTI therapist, cognitive behavioral therapy for insomnia therapist, or starting some sort of CBTI program. They can be done online, they can be done in groups, they can be done one-on-one. There's loads of resources out there, but really help to create a concrete and tangible plan with your patient. As I mentioned before, this is going to be a series of conversations with your patient. This isn't all going to happen in one visit, and you probably don't have time to go into all of this in one visit. But keep this dialogue open. You can save this video, use this as a reference for the 5 steps to go through with your patient. And remember, it can take a long time to get buy-in from the patients because it's scary for them when they can't sleep. So keep that at the forefront and help partner with them to alleviate some of those fears and help them build their sleep confidence. Patients can absolutely successfully get off these meds and sleep well. Without them, I have seen this happen time and again in my practice. So I'd love to hear from you. How would you handle this type of situation in your clinical practice? What has worked for you? Let me know in the comments below. This channel is all about practical clinical tools that you can use in your practice to better support your patients with sleep. Go ahead and subscribe to this channel and click the like button. Doing so is going to get this information out to more clinicians like you.